1 in 8 women worldwide will develop breast cancer in their lifetime. The ultimate outcome of that diagnosis is dictated by timing. This chart shows the divergence in survival rate based on when the disease is caught on the upper part. Early detection holds a steady survival rate over 90%. Along the lower part representing late-stage detection, the odds plummet. The factor separating these two realities is almost always a woman knowing exactly which biological abnormalities to look for. Waiting for a hard physical lump to form often means ignoring an entire sequence of earlier critical warnings. Relying strictly on the physical mass for detection actively compromises your timeline and reduces the odds of a positive outcome. Your most effective defense is the consistent establishment of a clear routine physical baseline. The optimal time to map this baseline is once a month, immediately following a menstrual period when the tissue is least inflamed. The observation zone includes the breast and extends into the armpits to encompass the surrounding lymph nodes. To check correctly, use the flat surface of your fingers. Broad overlapping sweeps identify changes better than poking with fingertips, which pushes past abnormalities. Memorizing the normal landscape of your own body allows you to spot a future structural deviation the moment it occurs, before a distant lump materializes. The body often signals structural changes right on the surface. Look for degradation in the skin's texture, specifically puckering or dimpling that mimics the rough, uneven peel of an orange. Notice if one breast suddenly shifts in size or shape compared to the other. Pay attention to the nipple. If it begins to turn inward when it was previously outward, that is a distinct warning sign. Monitor for any unexpected discharge, particularly if the fluid is blood-stained. Finally, you must check for unexplained redness, unexplained rash, or highly localized constant pain in one specific area. If any of these abnormalities appear, see a doctor within 1 week. Passive monitoring at this stage wastes your most vital window for intervention. Identifying an abnormality is only the first step. The second is seeking immediate medical intervention, which is where behavioral delays often occur. Medical data from Nigeria shows that most patients only present to doctor when symptoms become extreme, or when the lump is large or the pain is severe. This Venn diagram shows the factors driving that delay: low awareness, cultural stigma, and the fear of what a doctor might say, combined to prevent early clinical intervention. This fear of a confirmed diagnosis can lead to a psychological paralysis, keeping women away from the clinic that could help them. Most physical changes in the breast are benign. However, only clinical testing can confirm. The greatest threat to survival is often the human hesitation born from fear, which gives a potential tumor the time it needs to progress. To find abnormalities before they can even be felt, modern medicine utilizes the mammogram. By using X-rays to display these internal structures, screening programs for women over 40 can identify microscopic tissue changes well before they even manifest physically. While formal screening programs are limited in regions like Nigeria, the technology is available at most major hospitals. Women over 40 or those with a family history of the disease should proactively request mammogram access rather than waiting for an invitation. A mammogram secures a diagnostic window of weeks or months before a physical symptoms ever triggers an alarm. At these early stages, breast cancer is highly treatable and comes with a survival rate exceeding 90. The formula for protection is clear. Know your body's baseline, check the tissue regularly, and act immediately upon any deviation. Replacing passive fear with proactive, educated awareness is the most definitive step you can take to protect your health.